Good morning, students, and welcome. Today we are doing a case study presentation. This woman presented yesterday at the ER, and I wanted to run through the examination that we did and the findings that we uncovered through our examination and what we added to be doubly sure. The case that presented at the ER was a previously healthy 32-year-old woman who complained of dysphagia, trouble swallowing. She said that she had trouble swallowing solids, but was also having coughing and choking fits, even with thin liquids. She complained of a hoarseness of voice. Her voice did sound husky when we spoke to her and sounded deeper. She also explained that it was deeper than normal. She explained that she had a sensation of blocked sensation in her ear. She complained of left-sided facial weakness and asymmetry of the face. This is a checkpoint for med students to explain which nerves they believe are at play, which cranial nerves they believe are involved. We will begin by examining the olfactory nerve by giving a strong odor for the patient to smell. Hi, how are you today?
I'm not doing too well.
Okay, what's your name?
Jane Doe.
Is it okay if I do an assessment? I want to examine your cranial nerves, so those are the nerves in your face and neck.
Yeah, that's fine.
The patient has not complained in any change of sense of smell, but we are still going to examine the first cranial nerve, the olfactory nerve. Will you please plug one nostril, please? What do you smell?
That smells like coffee.
And it is indeed coffee. We will then test the optic nerve. I will now test the patient's visual acuity using a handheld visual acuity chart. Can you cover one eye and read the letters, please?
L-E-F-O-D-F-C-T.
Can you cover the other eye, please, and read?
D-E-F-P-O-T-E-C.
Now we will test color acuity. What number do you see? Nerves 3, 4, and 6. For the third, fourth, and sixth cranial nerves, we will look at the pupil, the pupil's positions, and symmetry. We will ask for the patient to follow the finger. Follow. And we will now test pupil response to light. The trigeminal nerve. Now we will examine the fifth cranial nerve, the trigeminal nerve. The patient has complained of facial weakness on the left side and asymmetry of symptoms. So we are going to do a pinprick test. Tell me when you feel.
I feel it.
Did you feel it on both sides?
Just...
The facial nerve. For the seventh nerve, we see that there is facial asymmetry with the left side showing weakness and drooping, and the patient has complained about this too. The vestibulo-ocular nerve. I'm now going to test the patient's hearing. So starting on the left side,
16, 98.
And now moving on to the right ear. On the right side, we see that there is a blocked sensation that the patient has reported and also auditory dysfunction on the right side. The cranial nerves 9 and 10. To examine cranial nerves 9 and 10, I have noted that the patient is complaining of hoarseness in her voice, and I can hear that as well. We are going to test now for a gag reflex. So we will now see the patient's gag reflex. Please open wide. Also, we can see some asymmetry when the patient is opening her mouth. Now I'll try and see. And there's no reaction. The patient did complain of this and said that suspecting that maybe the cranial nerves 9 and 10 are involved, but just to make sure, we will like to add from the classic test a measure of heart rate and blood pressure to differentiate between cranial nerves 9 and 10. If we do see any irregularities in blood pressure or heart rate, we can hypothesize that cranial nerve 10, the vagus nerve, may be involved. There are irregularities in heart rate and blood pressure, so we can hypothesize that cranial nerve number 10 may be involved. Cranial nerve 11, the accessory nerve. To examine cranial nerve number 11, I will ask the patient to raise their shoulders and push against my pressure. Raise your shoulders up like this. And try and push, keep them up and trying hard. Good job. And then, can you turn your head towards my hand and try and push me away? Thank you. Turn your head and try and push me away. Thank you. Cranial nerve 12. Cranial nerve 12, hypoglossal. And now to examine cranial nerve 12, I will ask that you open your mouth and extend your tongue all the way. See that there's no weakness and the patient is able to fully extend their tongue. Hypoglossal. In a classic examination of the cranial nerves, both cranial nerve 9 and 10 are examined together. With this patient, we believed that one or both were at play, but it was difficult to differentiate which one was causing which symptom presentation. For this, you might have seen in my examination that I measured blood pressure and heart rate. The blood pressure and heart rate was irregular in this patient, which could indicate that cranial nerve 10, the vagus nerve, may be damaged or may be involved in the presentation of symptoms. This case was loosely based on a real case study of a patient who suffered from multiple cranial nerve palsies, in which cranial nerves 5, 7, 8, 9, and 10 were involved. It is very rare to have multiple cranial nerves involved, and even more so rare for how many cranial nerves were involved. As I tried to demonstrate in this video, each cranial nerve played a significant role in the presentation of symptoms. With further testing, for example, a chest x-ray, there was a healer lymphadenopathy was able to be observed. This is the enlargement of lymph nodes. And then with a lymph node core biopsy, there was granulomatous lymphadenitis, and this allowed clinicians to diagnose her with sarcoidosis. The
inflammation and enlargement of lymph nodes, and more specifically, they believed it was neurosarcoidosis. It is very rare and it's very hard to diagnose, and surgical intervention is only reserved for the most life-threatening of situations. However, use of corticosteroids can help and can reduce inflammation and is usually the course of action. But again, this is extremely rare.